Working on hip joint health this morning, and specifically on the rotational capacity of our hips. This is going to not only get at the deep external rotators of the back of my right hip, but it's also, those directly tie into the proximal portions of the joint capsule and will help to improve hip mobility. The better my hip rotates, the better capacity it has and propensity it has for movement and other higher level endeavors such as squatting, deadlifting, jumping, running, you name it. All right, so we're going to train hip rotation in two different positions, in a hip flex position and a hip extended position. Hip flex position, you're going to bring some type of cable down, and I just have I don't know, it cost me $15 or so, ankle strap for your cable. I'm going to then get myself in a position where my knee is either mounted directly under the cable or slightly in front of. I'm then going to come down. I have the dowel or the half foam roller just there to stabilize. And I'm going to gently brace my left abdominal wall through an exhale. So the rest of my body is mounted into the floor. As I slowly, eccentrically, that is, control the weight all the way up, as high as I can go. At the top, I'm going to actively try and go with the load. So I'm going to try and rotate further, spinning around this axis. And my femur is pushed into my back pocket such that I feel a stretch in the posterior lateral that is kind of in my back pocket region of my right hip. I work hard for at least 5 seconds, and then I concentrically, that is, I pull back down. I try and leave my footprint into the floor by driving the outside of my ankle hard into the floor. 5-second hold, slowly extend back up. The amount of weight is to your discretion. I recommend starting at approximately 10% of body weight would be appropriate, but feel free to gradually increase as time goes on. When we're working with eccentrics and end range isometric training, a good bolus of about 3 sets of 10 to 15 repetitions with high intensity contractions that aren't provocative or painful would be the optimal prescription. Doing this multiple times per week would also garner better results than if I only did it once or twice. Again, we're working on joint health and connective tissue resiliency rather than on our traditional like muscle breakdown that necessitates several days, 48, 72 hours, etc., for adequate recuperation.